what it has shown is that it has brought the concept of being able to keep an organ outside the body maintained in a way that we can measure it, we can assess it, we can allow it to recover of its own natural recovery techniques, but also we can facilitate recovery of that organ or enhance its recovery. So really perhaps allow us to make organs that are even superior to the way that we found them. The current standard by which we preserve organs for transplantation is to cool them. So you slow down the process to death. However, if you slow everything down, you're also slowing down the ability to recover or the ability to actively repair. So the difference between that strategy and the ex vivo strategy is that in the ex vivo strategy we keep the organ at normal body temperature. So cells can work, they can begin to recover, they can heal, and we can facilitate regeneration. The way the system works is that we perfuse the lung outside the body, and the reason to perfuse it is to continue to provide nutrients, to remove waste products, to provide the oxygen and removal of carbon dioxide that the organs will need. We can also bronchoscope the lung, which means looking inside with a fiber optic scope. We can diagnose infection, we can look at the anatomy of the lung, we can deliver different therapies and drugs into the lung through this technique. This technique and this trial really heralds a new era in transplantation. Firstly, because we've changed the paradigm. We're not slowing down death, but we're beginning the recovery process even before the transplant starts. This technique will have a significant impact on the organ donor pool. The most important thing is if you look at utilization of donor lungs worldwide, only 15% of donor lungs on average are used. And the reason is that the other lungs, while they might be good, we can't be sure that they're good and safe to use. So the first major impact of the ex vivo system is some of those lungs that are good but we just can't tell, it will allow us to assess it. Ultimately, I think that having a lung that is better prepared for the transplant process will mean that we will have organs that will last longer and have our recipients live longer after transplantation.